Hi, how are you? Hope you are all fine, doing well. Today I will explain what is fistula. Also fistula in ano. What is fistula in ano? What are the definition, etiological factors, classification, clinical features, investigations, and treatment of fistula in ano. It is also called as perianal fistula or anal fistula. So, what is this fistula? Fistula, to say fistula, two openings should be there. One is internal opening, and another is external opening to the two epithelialized tissue. So, it is abnormal communicating tract between the anal canal and the perianal skin. That is the definition of fistula in ano. What is the Park's classification of fistula? So, it is classified into mainly 5 types. Commonest one is intersphincteric fistula, it is about 50%, and suprasphincteric fistula, it is about 7%, transsphincteric fistula 28%, extrasphincteric fistula 2%, and supralevator fistula, it is 13%. So, this is a Park's classification of fistula in ano. What are the etiological factors? Etiological factors, many times it may not be found. So, the commonest etiological factor is non-specific, and it is cryptoglandular in origin. The glands which are present, crypt glands which are present in around the anal canal, which becomes secondary infection, and abscess formation and tract formation. So, that is the commonest one. Specific causes includes means specific. We can find the cause. Crohn's disease is one of the commonest etiological factor which can cause multiple fistula tract, and ulcerative colitis, that is inflammatory bowel diseases, tuberculosis, HIV, human immunosuppression virus infection, actinomycosis, carcinoma, trauma, radiation, and for sometimes foreign body, and also sometimes rarely obstetric injury during delivery also can cause fistula in ano. What are the clinical features of this fistula? Clinical features are usually presents with abscess, recurrent abscess, perianal abscess. So, usually abscess features will be there. This patient comes with swelling, pain, tenderness, redness over the skin, all these things, features of abscess, induration will be there. So, then sometimes pus discharge, patient comes with pus discharge. So, sometimes patient also comes with the bloody discharge, then seropurulent discharge, and on examination there is an opening of the fistula tract. You can see the lining granulation tissue and a small opening, and so there are multiple openings also present in case of complex fistula in ano. And touching there is tenderness, and swelling may be present, induration may be present, signs of abscess may be present, sometimes may patient presents with the diagram. So, these are the important clinical features. What is this Goodsall's rule? Goodsall's rule is usually the line joining between the 12 o'clock and 3 o'clock perpendicular to the and horizontal course to the anal canal, anterior fistula and posterior fistula. Anterior fistula usually straight in course, whereas posterior fistula is curved in course to the opening of the anal tract. That is Goodsall's rule. So, these are the Goodsall's rule and clinical features. Next, investigation. What are the investigations? Investigation, fistulogram. Commonest investigation is fistulogram. So, dye is injected into the fistula tract through a probe and through a small tube, infant feeding tube, and the X-rays are taken, and you can see the fistula tract, which is how much it is extent from the anal skin to the internal opening into the anus, and sometimes rarely into the rectum. So, MRI fistulogram is one of the commonest advanced investigation. If there are any contraindications to MRI, you can go for endorectal ultrasonography, also equally effective as MRI. Next is sometimes anoscope, sigmoidoscope, proctoscope also can be done. Rarely, if it is eye anal fistula, it is open into the rectum, you can go for colonoscopy for the confirmation and for the technique confirmation of the fistula. So, these are the investigations, that is fistulogram, MRI, endorectal ultrasonography, sigmoidoscopy, anoscopy, colonoscopy. What are the treatments? Treatments mainly I will explain that what are the important procedures we do for this fistula. Fistulotomy is the commonest procedure, means lay opening of the fistula tract. This is mainly done for the low anal fistulas. Eye anal fistulas, you can go for fistulectomy. Next one is seton placement. Seton placement means non-absorbable suture material like proline is introduced from the perianal skin into the internal opening and tied and every 1 week it can be tightened, and after 6 weeks, once the high anal fistula becomes low anal fistula, it can be removed, and rest of the low anal fistula can be treated with fistulotomy or fistulectomy. Next procedure is endorectal advancement flap. Endorectal anal advancement flap also one of the latest method of treating this fistula. Laser treatment, laser ablation of the procedure of this fistula also can be done. Lift procedure. What is this lift procedure? Ligation of the intersphincteric fistula tract with the advancement flap reconstruction is one of it is mainly done for the transsphincteric fistula. And lastly, fibrin glue and plug insertion also one of the modality of treating this fistula in case fistula case. So this is about fistula in ano. So important points you should draw. What is a fistula in ano? Fistula in is communicating tract between the anal canal and skin. Pollux classification, that is intersphincteric, transsphincteric, suprasphincteric, extrasphincteric, and supralevator. And etiological factors, that is cryptoglandular origin inspection, and specific Crohn's disease, ulcerative colitis, TB, HIV, foreign body presence, actinomycosis, carcinomas, and radiation treatment, trauma, and obstetric injury. And clinical features, commonest clinical features are recurrent perianal abscess presentation, the discharge from the wound, that is blood, pus, fecal matters, and foul smelling. Sometimes flatus can be passed through the fistula tract, and opening of feces, opening of the tract you can see lined with the granulation tissue, and tenderness, that is swelling, diarrhea. That's good salts. Good salts rule is anterior fistula cut straight in cross, and curved posterior fistula curved in cross. So investigations, fistulogram, MR fistulogram, endorectal ultrasonography, colonoscopy, anoscope, all those things. Treatment, important types is fistulotomy, fistulectomy, set-on placement, endorectal advancement flap, lift procedure, ligation of intersphincteric fistula tract with advancement flap reconstruction, lift procedure, and fibrin glue and plug incision, laser ablation of the fistula tract also it is done. So thank you. This is about the fistula in or anal perianal fistula. Thank you.